Thanks very much for joining us this evening. There's some familiar faces in the crowd, which is really nice. To tell you a bit about me, for those of you who don't know me, so I'm Flo Kinnafick, and I'm a lecturer in the School of Sport, Exercise and Health Sciences, and I'm a lecturer in exercise psychology, which is going to be the basis of the talk today. I've been working with Mind for the last 3 years, and I'm going to integrate that information and that research into the talk today. So what I'm going to cover is a bit of an overview of mental health, kind of what it is, what is mental health, what is mental illness, an overview of the evidence that we know in terms of the benefits of physical activity specifically for improving mental health. And then I'm going to pull on some of those real-world stories that I've picked up within my research to give you some examples, really, and kind of how that formed in terms of a community-based programme. But I'll tell you a bit about that in a little while. So I'm going to speak probably for about 40 minutes, 45 minutes. It depends how much I can carry on. And then we'll have some time for discussion at the end. Okay, so what is good mental health? So the World Health Organization, they state that good well-being or good mental health in an individual is when they can realise their own abilities, they can cope with those normal stresses of day-to-day life. So kind of working long hours, potentially having difficult situations in life, but able to cope and able to go through those normal stresses and cope with that. They're able to work productively and fruitfully, so push themselves and make a contribution to their community. So if you think about poor mental health, it's when an individual can't do that. So when the demands that are placed on an individual in terms of any events that are happening, and those demands exceed what they're able to cope with. So if you're working long hours, you can't quite handle it, you can't cope, it's difficult, then your mental health is going to suffer. Okay, so if you think about that's mental health, so what is a mental illness? So mental illness is a clinical diagnosis, so I've got some examples here, so bipolar, major depression, schizophrenia, and it's medically diagnosed. And it results in a significant impairment of an individual's cognitive, so their thought processes, affective, so how they feel, so their emotions, so their moods, and relational ability, so that's connecting with other people. So this is when there's a prolonged impairment in those elements. And it's a result from biological, so genetics potentially, developmental, so an example is dementia or brain injury, or psychosocial factors as well, so lifestyle behaviours potentially, trauma that's happening. Mental illness is managed much like a physical illness, so in terms of the management of it, the prevention, also the treatment and the rehabilitation. So it's managed in the same way as a physical illness would be. I think it's important to note that mental health is not static, and it does change over time depending on these biosocial factors. Okay, so things that happen throughout your life. And also, it's important to note that you can have a diagnosed mental illness but be flourishing. You can have good mental health, but with a mental illness, if it's being managed, if you are able to function day to day. And then the same goes that if you can have poor mental health, but no mental illness symptoms with it. Okay, so it does change over our lifetime. And there's a global focus on improving mental health. I think we've all kind of hear on the news, there's lots of information about that global focus towards improving mental health at the moment. And I've just got kind of the reasons why these stats here. So it's estimated that 1 in 6 of us will experience a common mental disorder, so depression or anxiety, in the past week. Okay, so that's definitely a few of us in the room. And 1 in 4 of us will have a mental health problem in any 1 year. Okay, so again, kind of that's definitely a few of us. So that prevalence, there's a lot of mental health problems which we are more aware of them, and also kind of the stresses of life are continuing, and this is causing a problem. So now, worldwide, major depression is thought to be the second leading cause of disability worldwide, and a major contributor to the burden of suicide and ischemic heart disease. And actually in the UK, it is the leading independent cause of disability in the UK. So again, kind of thinking real prevalence is really important. And the number of people living with depression has increased and continues to increase more than 18% between 2005 and 2017. So kind of, they're quite alarming statistics that that we're getting through here. So you can understand why there's a focus on trying to improve mental health. Also, people with poor mental health, and particularly mental illness, they have a reduced life expectancy of up to 20 years. And that's largely due to physical health inequalities. So people who have mental illness are more likely to be overweight, obese, have heart disease, and therefore that contributes to that poor life expectancy. Also, they're more likely, I think it's 20 times more likely to smoke. So kind of real high levels of physical inequalities, and that results in life expectancy. So those elements are things that physical activity can help with. So having good diet and exercising often can help with those physical health inequalities. So we're starting to get the link with mental health and physical activity. There's also, because of this focus, because of this prevalence, there's a lot of support within the sector for physical activity and to support mental health. So Sport England and the Lottery Fund in 2016, they launched their 5-year strategy and pledged 250 million to improve inactivity in the country. So just physical inactivity. So we know lots of people are not active enough, and that was 250 million. However, they've also said that throughout all of their projects that they fund, that it has to have an element of mental health. So measuring mental health, focusing on improving mental health through their programmes. So even though it's improving physical inactivity, the mental health is a real focus throughout. Also, Public Health England have their moving healthcare professionals at every level. Their Everybody Active Every Day was launched in 2015, and that was basically, again, kind of a public health focus on improving physical activity levels and moving healthcare professionals at every level. This is in terms of getting any health professional working with any kind of population, GPs, primary care, to physios, kind of all the different clinicians in terms of working with people to get them to move more in terms of treatment, and mental health was in that very strongly. And then thirdly, just to illustrate that kind of sector support, the Faculty of Sport and Exercise Medicine UK, they've teamed up with the Sport and Exercise Psychiatry Special Interest Group with the Royal College of Psychiatrists to really provide a position statement, really, to say that the role of physical activity is important in treating mental health. Okay, so that's kind of a real statement, position statement from clinicians who are face-to-face with, on the front line with people who have mental health problems. So there is real growing support for this. And here, just a lot of journal articles. This is just a handful of now the convincing evidence that we've got in terms of physical activity can improve the quality of life and of people with poor mental health, but also improve mental health. Okay, and this is in terms of management and improving those negative or positive symptoms of poor mental health, but also in terms of acting as a buffer, so that prevention. So there was a new paper that came out just last month, and there was 40,000 people who'd been looked at in terms of, and it's actually that one just there, and that was in terms of people who are regularly active are less likely to get depression, okay, in the future. So really the exercise is acting as a buffer for individuals. And the evidence is now at a point where the National Institute of Clinical Excellence, so that body which provides guidelines on how to promote excellence in clinical situations, that they are recommending exercise as a treatment for depression within their guidelines. So, and they've kind of been quite specific in terms of what what they're expecting. So that group exercise classes, 3 sessions per week, of around 45 minutes to an hour, and that's over a 10 to 14 week period. And this is for mild to moderate depression. So as the evidence, more evidence comes in, and I'll tell you a little bit in a minute about the complex relationship and why that evidence is taking a bit of time in terms of strong, good quality evidence to come through. And just to highlight here, we've got 10 to 14 weeks, and this is taken because of interventions, programs that have been put forward, which are a certain length of time. But actually, I would argue that we want people to make this a lifestyle. That's the important thing, so continuing. So perhaps 10 to 14 weeks, you'll start to feel those benefits of the symptoms, but you want to have a regularly active lifestyle to keep those symptoms at bay, potentially, or improving your quality of life. However, there's a lot of evidence which shows that people who do have mental health problems are not active. They're significantly less active, and they engage in significantly more sedentary behaviour. So sedentary behaviour in sitting, lying down, watching TV, whatever you do, kind of stationary. Individuals with poor mental health are significantly engaging in more of that type of behaviour, and they're much less active. Okay. But we also know that people who have poor mental health experience more exacerbated barriers to exercise. So it's more difficult to actually go out there and exercise. And often they're inversely related to those outcomes that we're trying to achieve. So people with poor mental health will have low mood, they'll have low self-confidence, they'll have low motivation to actually go from that. So that's the kind of thing that exercise can help. So exercise can lift our energy levels. It can help us with our self-confidence for lots of different reasons. But then that's kind of an issue with people who have poor mental health. Those barriers are more prevalent or more important to that person. Also poor social support. So that's another thing. So often kind of if you don't have that support network, and it's known that people who do have poor mental health or mental illness have a reduced social network. So if you don't have that social support, then it's more difficult to go out and do exercise. Low motivation, as I said, and also stigma around having mental health problems as well, and self-stigma. So that stigma that you put on yourself, so thinking that you're not worth it, you can't exercise, so you won't because you can't think straight or whatever the reason may be. So those kinds of things are going to make it harder to exercise. So people are not exercising, but they've got these barriers which are really difficult to overcome. Okay, so what does the evidence actually tell us? Kind of that strong evidence, that good quality evidence that is published, has been peer reviewed, tells us that treatment for depression, exercise can be a treatment for depression, and it can be a standalone treatment, so just exercise on its own without any medication or other therapies, or in combination with psychological therapy or medication. And that standalone is usually with more mild to moderate levels of depression. And people who exercise daily, so they engage in some kind of physical activity, have a reduction of depression by 20 to 30%. So that's pretty large numbers, that what you can achieve by exercising daily. When I talk about exercising, it doesn't need to be going to the gym or kind of going running or cycling. It's a brisk walk is enough. Kind of 30 minutes of brisk walk 5 days a week, or that 150 minutes, which are the recommended levels. So that is enough. That's what I'm talking about, keeping moving. Also, it reduces levels of anxiety, so there's a little bit less information about anxiety and exercise, but again, that's coming through. But it reduces levels of anxiety and distress in people with mild symptoms, again, by 20 to 30%. There's fewer side effects than antidepressants. Often with antidepressants, people will gain weight. With exercise, then you've got the weight management element, so there's less side effects. There's less stigma attached to exercise as a therapy rather than going to counselling or taking medication. So there's less of a stigma around that, which may suit some people. And it's available to all, so there's lots of positives of exercise. So it's low cost, anybody can go and walk around the park. And I was just going to say, apart from if you Gareth Southgate, because he's just popped his shoulder out running. So yeah, there's some barriers to exercise, but generally there's low risk. And also in terms of dementia, it reduces the risk of cognitive decline, again 20 to 30% in those adults who are daily physically active daily. And then we can also talk about what context that you can exercise in. So walking in green space, so that's going to give you that additional benefits as well. So evidence is pretty strong in terms of the restorative effects of green space. So if you think about your brain is like a battery, and over the day it gets depleted, so you're having to concentrate on lots of different things throughout the day, and that energy is depleted. And green space is restorative for that. So it allows you to have focus on things without that attention, without that concentrated effort to kind of reduce your energy further or your attention further. And so what that means is that you can have recovery from mental fatigue and reduce stress by being in green space. Also being part of clubs, sports clubs and sports teams, that context of being in a group. So where you're in communities that are supportive and welcoming, again, there's good evidence to say that is a good context in terms of being physically active if you do have mental health problems. Now, this, I don't expect you to get this slide or take it all in, but I wanted to kind of illustrate that the evidence, we've got good evidence that yes, exercise is good for us, for our mental health, to keep us a status quo, to improve our mental well-being. What we know less about is the mechanism. So why is that happening? And there is evidence out there to suggest it, but it's not quite as good quality as, yes, we know it works. So I just put this up because I wrote a report a little while ago on the benefits of exercise for mental health. And I did a bit of a mind map to be like, hey, what is the evidence? Where is it going? And this is what I came up with. So it's a complex relationship. It's not just, okay, you exercise and you feel better. It might be that you exercise, you start to feel better about how you look, and in terms of your physical self, so how you might feel better because you feel a bit fitter, you feel a bit stronger, and therefore that improves your self-esteem, and then you might be motivated to do more, and then you're going to get an improvement in your mental well-being. So there's all these steps in between that result in that benefit. Okay, so in terms of that complex relationship, that's what I mean. It's not always as straightforward as, yes, it's good for you. Okay. And also what we found is that there's various types of exercise that you can do and you're still going to get benefits. So there's evidence for weight training, there's evidence for individual exercise, there's evidence for group exercise. Okay, it's not necessarily the type of exercise that's important, but it's sustaining that exercise, so being regularly active. I know recently there's kind of been a bit of a surge in evidence in mind-body type exercises, so Tai Chi and yoga in terms of mindfulness, so staying present in the moment, and that is because it takes you away from the rumination of what you're thinking about and you can focus. So we've got like different types of exercise which are beneficial, but they need to be maintained. So that's where I'm coming into kind of the programs now. So why it's important to design effective, acceptable. So when I say effective, that they work. So actually people are improving. They're acceptable in terms of the people who are taking part won't like it. It suits them. It meets their needs. And sustainable exercise interventions. So you don't have that program, okay, you've got 10 weeks, stops, and there's nothing more. It's got to be sustainable. It's got to allow people to continue with their exercise. And that's essential to engage people and also maintain that kind of behaviour. So this takes me on to the MIND programme. Okay, so like I said before, I've been working with MIND since 2014. on their Get Set to Go programme. So Get Set to Go is a national physical activity programme for people who are mental health service users, so Mind members. It was funded by Sport England as part of that 5-year strategy, and the Lottery Fund as well. And we were the academic partners, so we were the independent evaluators of the programme to find out how it went, how it was experienced, and what was going on. I've got 2 links on that slide. The academic report, if anyone wants to go to sleep very quickly, or there's a summary of the findings that you can have a read about as well, and if anybody wants to get hold of those, you can on the Mind website or contact me. And there's some nice infographics that they produce from that. Lorna, my PhD student here, has been working on that kind of as her project, her PhD, for looking at social support in particular. So I'm going to tell you what the programme looked like. So there was 8 local minds. So there's a national mind team that are in London, and then there's hundreds and hundreds of local minds across the country. And they're all governed separately. So they're all governed by their own kind of teams, depending on what facilities they've got access to, those relationships and the funding that they've got. So there was 8 local minds that were funded to host this programme, if you want. So there's 2 up in the northeast, 2 in the West Midlands, 2 in London, and then 2 in the northwest. And so we were visiting those sites, which was really interesting, and certainly to see how they were run differently across those local minds. So each local mind, they had one key contact, which was we called them a sports coordinator, which was a paid role, and they were looking after the programme in each of those local places. And they also trained up volunteers, so people who had gone through Mind services and they wanted to volunteer to help facilitate those sessions. They were trained as peer navigators, we called them, but kind of peer volunteers. And what they did was they helped lead the sports sessions of whatever those sports sessions were, because there was a real big variety. There's bowling, badminton, climbing, cycling, running. There was loads of different things going on. So these volunteers who had lived experience of mental health themselves, they were going through their own mental health journeys, they were leading the sessions. There was also group sessions. So there was also opportunities to have one-to-one contact if you wanted, like a buddy system. So you signed up and then you allocated a volunteer. So we had 224 volunteers were recruited throughout those 2 years, and 3,585 participants actually accessed the programme, so they registered for the programme. Now, along the 2 years, as you might expect, people came and went, some dropped out, some were there for the whole time, and I'll tell you a bit more about the qualitative information that we got. That's the amount of people registered, but it was very kind of different in terms of how many people were there at the end, because it was like a rolling programme, so people could come and go as they pleased. Okay, now just to give you a sense of the approach we used to evaluate the programme. So what we wanted to understand was not just, okay, are people's mental health improving? We wanted to understand why that was, and what was it about the programme or within the context that allowed change. So were there certain triggers that were happening as part of the programme, as part of some of the components of the programme that were allowing this change? Okay, so in essence, we wanted to find out, okay, what works for who, in what context, and also why, to really get into the depths of what was going on. Okay, so to tell you a little bit about what we actually did. So we collected lots of survey data over 1 year period. So 4 times when people registered, they filled out the survey after 3 months, after 6 months, and then after 12 months. And then we asked a variety of questions in terms of their demographic, their diagnosis, age, gender, ethnicity, etc. But we also asked them about how much exercise they did, their mental health, so their mental well-being at that time point, whether they perceived that they had social support around them, their self-efficacy, so whether they felt that they could achieve day-to-day, their motivation and their barriers to exercise. Okay, so those kinds of things were what we were asking, because that was the targets of the intervention. So who took part? We had 725 people who completed this survey. And I've just chosen 3 of the age ranges that we collected just to kind of illustrate that this programme was a huge range of ages that took part. So for people from 18 to 20, there was 72 people, and then 61 plus, there was 45. And there was definitely a gentleman who was in his 80s who was part of one running group. So it was really kind of accessible for lots of different ages. And actually had a similar in terms of male and female. So it was pretty half and half for that. And in terms of diagnosis, you can see anxiety and depression were the most prevalent diagnosis that we had. And stress here, whereas that's not a mental illness, it is certainly a precursor for poor mental health. So that's why we included stress on that. And we also conducted loads of interviews and focus groups around the country, and I think we've got about 45 hours of qualitative data, so we really were able to get a good insight into the experiences of those individuals. And we conducted those all around the country with the participants, also with the volunteers to understand their experiences, and also those sports coordinators that were running the programme in each of those local mines. We wanted to understand their experiences, their barriers and facilitators. So the people that we had coming to the program, to these interviews, were those who had were continuing with the programme, or those who had lapsed as well. So people who had dropped out and came back. So they did take part. I think we only spoke to one person who dropped out completely. So that again is kind of something that needs to be addressed across the board in terms of our evidence. Is people who drop out, why do they drop out? And they've dropped out and then we don't find them again, which is that's the information that's kind of missing. But we did get some of that with the lapses. So in terms of the actual exercise, there was improvement. So at the beginning, 82% of people weren't meeting those recommended levels of exercise. So recommended levels are levels that the Department of Health have issued to say that you should achieve that to improve or maintain your health. And that's 150 minutes of moderate to vigorous exercise. So getting a little bit out of breath, kind of a brisk walk, and that can be done in bouts of 10 minutes or more. So 82% of that the baseline people, so people who registered, weren't meeting those recommended levels. At 3 months, so it was around 2 days that they were exercising for. At 3 months, there was an additional 1.5 days. At 6 months, it was an additional 1.6, not on top of the 1.5, but on top of the 2. And that reduced a little bit at 12 months. So you can see we have 2, 3, 4. So you're starting to get close to those recommended levels at 6 months. And so we found that physical activity improved in those who completed the survey. And what was really interesting with some of the qualitative data is that people said that walking was something that they could still engage with even when they felt low. Okay, so even when they were having those negative thoughts or those low periods in terms of their mental health, walking, they were still able to push themselves to go out and walk. So someone said, it's taught me that even going for a walk is a good form of exercise, and one that I've found does help my mood rather than sitting at home. So even if I don't have the motivation to do vigorous exercise, a walk is good for me. Okay, so that's a really important thing to think about, that walking can be incorporated into these programs with success. So those people who exercised on more days, so if you think about the relationships here, so people who told us that they exercise more, they also had better mental well-being, they had better overall health, they perceived that they had better social support, and they felt that they were able to cope and be more resilient. Okay, so that is one point in time, so it's not necessarily, we don't know kind of if that's because of the programme, but it does support the evidence in terms of people who are regularly active are generally kind of better in health and are better in terms of community and their social group. So perceived social support. When I talk about perceived social support, what I mean is that someone feels that they're cared for and that they know that there are people around them that can help them in at any point in time. So this also increased from at the start. So if I explain this graph, so that blue line is those people who are on the programme, and then the orange line, that's a comparison to people who were not taking part in the programme. So you can see the perceived social support improved from baseline to 3 months. So that's a positive. So people were going to this programme, they felt that they had better social support. And that's really important because social support is one of those most highly cited barriers to exercise. So if we can start to target those barriers and improve those barriers, then it may be that people are going to exercise a little bit more. Also, kind of that absence of social support, as I mentioned before, it can lead to more stigma and self-stigma, so that can exacerbate those barriers further. And then also, we know that establishing social relationships for people with poor mental health can then lead to improved self-care strategies. So people are more likely to engage in behaviours that are going to help themselves if they have that social circle around them. So that's quite an important finding as part of the programme. But what's also important is understanding how that happened. So it's great that people had improved social support, but what was going on in the programme to increase that? So there was increased social interaction. So you might expect that if you're going to these programmes that you're going to meet more people. Okay, so yes, there's increased social interaction, but it was the quality of that social interaction which was really important. And it was the lived experience of mental health problems, sharing similar experiences, being in a situation where they didn't feel judged, that they felt valued as part of this community. That's what was leading to that improved social interaction. I think somebody told us that they felt they didn't have to be on their best behaviour anymore in these situations where, you can see how that's really important if you feel that in the rest of your life you're having to behave yourself or feel that you have to behave in a certain way. Having a place where you can just be who you are, it's really important. And it just highlights the importance of programs like this in terms of loneliness, trying to reduce social isolation, which again is becoming a problem or a focus in terms of funding and programs. And I'm going to see, actually, I've got a quote here, whether it works. There's no sound.
I've had a similar experience, just having sound off, I suppose, but also it's just comforting when you're there, that if you're anxious, you sort of stick together. Groups are just great. I go to one, I've got like a few best mates there now. We go out for meals, we do stuff, we all talk. When one of us is down, the rest of us help get that person up.
So that was kind of really what they were saying in terms of helping each other when they felt down. So that was a really important element. So mental well-being, so we measured that 4 times along the year. So that didn't change, so it didn't decrease, it didn't increase. The people who were taking part had enduring and quite complex mental health issues. And measuring, I think this may have been a measuring limitation as well, so measuring that at 4 time points, you may not get the whole picture. But what we did find, and this kind of supports that complex relationship, that people who were engaging in exercise, it was almost like a first step for them. So they would be part of this group, get experience kind of more social interaction, that good quality social interaction, and then access more opportunities, and then that kind of just furthered their recovery a little bit more. So it's that journey, if you want. One guy after this programme then accessed a 12-month NHS support programme that he just wasn't not ready for before the programme. So it's kind of those little stepping stones. So that was really important in terms of, okay, it's not going to cure a mental illness, but it may help to access further opportunities to help somebody care for themselves a little bit further. But certainly what we did find with the qualitative, I've got another quote here, with the qualitative element is that people, that acute, so when you exercised on any one day, that day people felt great. So the energy levels that exercise brought to them, that was really evident in the evidence.
I've always found that exercise is the one thing that gets me well again with the depression. So yeah, and it's invaluable. It's excellent. It makes me feel great, just healthy and active. I don't feel as tired or lethargic when I exercise, and it makes me feel happy and content in myself.
Okay, so that was another quote. These quotes, I collared some PhD students to read those quotes. Okay, so you can see that kind of immediate effect, so increasing energy levels. And this is another quote to illustrate that after this person had done exercise, they felt on top of the world. They felt really kind of lifted and high energy levels. But what we did find on the kind of contrary of that, some people engaged in too much exercise that they could handle. So they started to do a little bit more, go a few more times, and then they would become anxious about exercising enough, and that would keep going. So that's where the volunteers and the coordinator were really important in terms of trying to educate those individuals or just help them to understand when to stop, okay, and that it was okay not to exercise on some days. So there is that fine line to understand kind of where people are at. So again, kind of the targeting barriers, those people who said that they had the least amount of barriers, they also had the better mental health and physical health. So again, you might expect that in terms of the relationship. So again, that was an important target for the programme. So then thinking about the motivation. So when we talk about motivation, or kind of us psychologists talk about motivation, we don't necessarily talk about the quantity of motivation, but it's more about the quality of motivation or the type of motivation that you have towards something. So you've got autonomous and controlled at either end of this spectrum of types of motivation. On the one end, this is the good quality motivation, so that's all the stuff that we want to achieve, is I love doing it. I am doing something because I enjoy it. It feels great, I love it. Okay, so that is really what anybody in behaviour change wants to achieve to get people to exercise. They want people to love it and enjoy it. What is also another good motivator or good type of motivation is that you can see the value in doing the exercise. So if you can see that it's important, you're getting some of these benefits from it, and that's actually important to you, or you're getting something out of it in that sense, that's also positive, and that's also what we want to try and achieve. And then you've got the poorer quality of motivation this side, and that is what we want to avoid or push people away from, is that I should do it. I should do it because my GP told me to do it. Okay, I don't want to, but I should do it. Or I should do it because I told somebody that I'd meet them, and if I don't, I feel guilty that I've let them down, etc. And that is not going to last. That gives you kind of even more internalised pressure, which is negative and not conducive for continuing with that behaviour. Because if you feel guilty, then you're going to try and avoid feeling guilty, so you won't even do that again. Or you have to, and this might be, you're pressured in, your GP's told you have to do it, and you're put into a programme, and again, that's not going to last. And then this side again, you've got no motivation, so you're not even thinking about it, you're not interested. Okay, so in terms of motivation, that's the good stuff over that end is what we're trying to achieve. So what we found was people who had that good quality of motivation, they also had better mental well-being, they had better coping and resilience, they had better perceptions of social support and overall health. So really important to try and increase that good type of motivation. There's lots of ways that we know you can do that, and which I'll go into a little bit in a second. It might be the next slide. But in terms of certain behaviours that people around you can take on, so not being judgmental, for example, providing you with a rationale. So why should you engage this behaviour? Because you might get these outcomes. Making it fun and enjoyable, asking people to have an input themselves. So if they're having a choice in what they're doing, then they're more likely to enjoy it, they're more likely to feel like they're in control of the situation, and that they can that's going to lead to better quality of motivation. So, okay. Thinking about kind of what context and what mechanisms, when I said about the approach, we're trying to find out what it was going on in that programme that was achieving positive outcomes. And I'm going to tell you about positive outcomes, but also kind of when things weren't going right, because that's really important to understand as well. So when things are not working, what was going on. So group sessions, that was really key, and that supports the evidence that we've got already. So that was the popular element. Rather than the one-to-one, it was the group sessions that were working. And we know that in a lot of programmes, not necessarily with people with mental health problems, but kind of the general population as well. And again, like I said before, that lived experience of mental health within the group programme, the group sessions, that was really key. I'm just going to play you this quote, and then...
I've got people in the same boat as you, because when I studied, no one knew I had a mental health problem. So I just feel more confident in people like myself, because if I'm feeling a bit bad, I can say I'm feeling bad, instead of hiding it all in. So it's just totally different. You feel like lost, don't you? You feel like it must be only you that feels like this. Nobody else can feel like. So when you get to know other people who've got the same feeling, it really helps. It's a community down there, it's great to be part of something and actually be me and not putting on a disguise. It's a lifeline for me, because with people in our circumstances, you don't feel like you're being judged. You can just be yourself. And everybody that I've dealt with through mind, it's just, fantastic.
Okay, so that was kind of what I was talking about before in terms of someone, their experiences of the group, and that was really important. What was also important in terms of that lived experiences of mental health was having the volunteers there who were leading the sessions. So those people who were leading the sessions had the experience of mental health problems, so they could they could understand what people were going through. However, what was really important, and this was important in terms of the volunteers, their own mental health, but also the attrition of volunteers to the programme, is that they had a clear support process. So those volunteers who were part of the programme, they had a clear role. They knew they had kind of a debriefing process. They had a point of contact, and when that wasn't working, then it led to volunteers dropping out. They felt pressure for people who would disclose things to them, because they felt that the volunteers and the participants were on the same level as them, so they would disclose problems, and then that put a lot of pressure on the volunteers who were also going through their own mental health recovery. So that was really important in terms of using peer volunteers. Looks like it's really successful, but there's got to be processes in place to make sure that those volunteers are looked after as well. So thinking about those group sessions then, and these were held in mainstream facilities, but within the Mind umbrella. Okay, so the point of being in mainstream facilities was that people would continue to exercise and carry on with that in a familiar environment. So when we asked participants about exercising outside of those programs, okay, so if this was to stop, would you still go to that club? It was an absolute resounding no. So it was too frightening, not now, no, no. So the next person said, maybe in like a few years when you're used to doing it, actually doing it, but I couldn't go straight in. And I think what's really interesting here is that it's the words a few years which is used. So it's not, a couple of months down the line, I think I'll be able to do it. But it's kind of that unattainable goal, which is so far away, I'm not thinking about it. So I think that's really important, that you have to concentrate on really embedding the programme into mainstream facilities, but allowing people to slowly make that transition for it to be sustainable, for it to carry on. And then the supportive social environment. So that was an important part of the whole process. We talked about the group sessions were important, but it was what was going on in those group sessions, which I've alluded to already. So there's three important people who were sources of support, if you want. So usually when we talk about sources of support, it's someone that is in a position of authority, or you feel that you trust them, you listen to what they say, because what they say is right. Not always, but that's kind of what you think about in terms of a source of support. But actually, in this case, the peers were also a source of support, and a really important source of support. The volunteers were a source of support, and also the sport coordinator. And the sport coordinator didn't even necessarily meet the participants, but they were still known as a source of support. And there are certain behaviours that these individuals took on, which provided that support. And when those behaviours were absent, or people kind of undermined people's that social environment, if you want, I'll give you an example. Then that kind of all broke down, and people would lapse. They kind of felt that a bit more sensitive to kind of cold interactions, and so they dropped down. And this was really important in terms of the first session. So some individuals took 3 months just to get through the door. So that was really important, that first interaction of the first session. They would drive to wherever they were going, but then go back home and not actually step foot into the programme. So it's really important. And these kinds of behaviours, so encouraging participation, facilitating the learning of new skills, so even kind of real small steps of learning new skills and new competencies. And again, that's going to be that building block to improving further things. Making the focus on fun and enjoyment. So it's not about the mental health problem. Actually, it was a time when it could be about playing sport, engaging in exercise. It was a normalising behaviour, if you want. So the same behaviour that everybody can do and lots of people do. So focusing on fun and enjoying and laughing. That came out quite a lot in the qualitative work, that people wanted to laugh, and they were doing that. And providing that information so people can understand why they're doing it, accepting people's behaviours and beliefs, again, that non-judgmental approach, acknowledging negative feelings. I'm definitely a regular exerciser, but sometimes I don't want to. Like, it's okay to have negative feelings. And that demonstrating trust and understanding is really important. And again, the setting those realistic goals, and providing advice on overcoming barriers. So the example that I've got in terms of different types of supportive behaviours, so there was one volunteer who came in and was really sort of saying, you have to do it this way, or there's no other way that you can do it. And that really hit the group hard. And they were apparently all talking about it in the local cafe that day. Somebody didn't go back for 3 months. And it really kind of affected them. There was a lot more sensitivity towards kind of cold interactions. So if you want people to maintain and sustain that behaviour, it's really important. And then another person went into a leisure centre, and the lady on reception said something really welcoming and helped her when she was a bit anxious to go to the changing rooms or whatever. And that interaction is what allowed her to go into the session. So that kind of supportive social environment, I don't think you can place enough emphasis or importance on that. Okay, so I'm not going to keep you too much longer. Another couple of other things that were really important throughout the programme was the use of text messages. So there's been some research done in terms of messaging and how you can prompt people to behave. But what we found here, it was the content of those messages was really important. So the messages often came from the sports coordinator, and when they were personalised, and when they were to somebody who maybe hadn't been for a couple of times, or it was a reminder of a session, but specific to that person because they liked that session, then that really worked in terms of people thought, oh, you want me to go to that session, you want me to be there. That feeling of being valued and, remembered even, it was really important. But then in another of the local minds, a blanket text message went out, which was just to everybody, no personalisation at all. And again, that really affected people. They thought, you don't care about me, you don't care if I turn up or not because you don't even know my name. So that was really important. Again, you can see that kind of social connection, which is really important. Clear structure to the programme, clear structure to the sessions was very important in terms of continuity and stability for the participants. So this goes hand in hand with good communication. So if sessions needed to be cancelled or moved, that impacted that clear structure or the continuity. But if you had good communication, then it sort of helped to mitigate any of those circumstances. And that was really essential to have good relationships with those sports facilities. Just because if sessions were cancelled but people didn't know, or if the place where they needed to pay for the session moved, again, that really disrupted people's anxiety of what they had to do and where they had to go. You can imagine it yourself. If you're not sure of going somewhere, I'm always like this on buses. Like, I can't handle it because I don't know which stop to get off. And so you can feel that you're a bit nervous or worried about that. So you can see how this can be exacerbated with people who do have mental health problems. So just the last couple of slides then. What we found, kind of what works, what was really important. That whole system approach, so having the connections with the mainstream facilities, so using the expertise that's already established in the community, having those good relationships, that's really important for sustainability. Access to those safe opportunities and facilities, activities based on individuals' choice and personally determined goals, so they could choose which exercises and which activities they went to, and the group-based interventions. And the peer model, so having that lived experience of mental health, people who've got experience of mental health problems, being a real core part of the programme, that was a real successful element, but it's complex and it's quite difficult to embed. So there's a lot that needs to be thought about within community programs if you want to achieve that approach. So it's really important to decrease the pressure for the participants, which peers can, but you don't want to increase the pressure on the volunteers that are taking part. So, and it provides an opportunity for people to socialise in that safe environment. Okay, so just to summarise everything I've talked about, is that group-based, peer-led community programmes, but with support from mainstream facilities, can engage those people with mental health problems. But it's important to have that supportive social environment. That's really, really key, which encompasses lived experience, that peer model. Sources of support come from different people, including those other people who are on the programme. You've got to look after the volunteers to have a clear process, role description, and also mentoring. And so what we kind of found, that physical activity has the potential to improve the quality of life of individuals with poor mental health, but it's not a given. It only happens with certain mechanisms or certain contexts, okay, that you need to be considered when you're doing the programme or building a programme or creating a programme. So just to finish, and this is one of my favourite quotes from kind of all that 40 odd hours of qualitative work that we had, that someone said to us, so many years they've kept running away from all the opportunities and now they were running towards them. And that kind of encompasses, I know it's really nice, it kind of encompasses that feeling of, it was just that next step. It was just kind of helping people to progress with their mental health. So thanks very much for listening. And I don't know if anyone's got any questions.